Welcome back to Smitty's Learning Room. Today we continue to look at the option sports medicine, and we're going to have a look at the concept of RICER, so R-I-C-E-R. So for some of you, this content you would have already seen before in the preliminary course in first aid, but it's just applied a little bit differently in the HSC course. So today we're going to continue looking at how a sports injury is classified and managed. We've already looked at ways to classify them, and so this way we're looking at a soft tissue injury today. We're going to have a look at the inflammatory response, and we're going to explore ways to manage soft tissue injuries, and this video will look at RICER, so rest, ice, compression, elevation and referral to deal with the inflammatory response of soft tissue injuries. So we start by having a look at the inflammatory response, and what is it? It's basically a response from the body that is associated with soft tissue injuries, and the response is initiated to help repair the damage of body tissues. It's basically the body's initial response to injury because it's trying to stop any further injury from happening, and what that looks like will be a little bit different for each person, and obviously depending on the type of injury that you have sustained. Now, as soon as that inflammatory response begins, that's your body's way of saying it started to try and heal itself. So as said before, depending on the severity of the soft tissue injury, the length of response and treatment will vary. So obviously like a grade 3 tear will be a lot more serious and the response would be a lot different to, say, a grade 1, a minor strain, where you may not as notice a bigger response. So let's have a look at the inflammatory response. The first thing that happens is that the injury happens. So for example, in this case, a rolled ankle. And then what happens is it goes into some certain phases. And we had the first phase, which is acute inflammation, where we have an increase of blood flow to the area. The second stage, or the third thing that happens, is the repair of the inflammation. So we get an increase of plasma, white blood cells and protein to the area. And then that final stage is what we call the remodeling stage, where the body tissues can be healed. So let's have a look at these stages a little bit closer. So the first stage, the acute inflammation, this is when we have that increase of blood flow. So we've got an increase of fluids to the area, which is going to cause a lot of pain and swelling and sometimes loss of function of that joint. It's really important that at this stage not to do anything, so to obviously rest, by applying RICER, because this is where the inflammatory stage can actually do more damage if the athlete doesn't rest. So this stage actually lasts for 48 to 72 hours, and it's essential that RICER is applied during this stage to ensure that further damage doesn't occur and to allow for a shorter period of recovery time for the athlete. So the next stage is our repair stage, and the repair stage is when we have this increase of good things to the site, so plasma, white blood cells and protein, and the body begins to fix the damaged area and starts to remove that excess fluid. So white blood cells come in and they help to clean up the area, and new tissues start to begin to be developed. So if you've torn you've had a strain to the area, these new tissues will replace them. Now, scar tissue is developed during this process, and the thing to note about this is that scar tissue is weaker than normal tissue, and because of this, you need to try and decrease this scar tissue growing. So you need to, again, rest your body so that scar tissue is minimal because it is not as strong as a normal tissue. And this repairing stage can last between 3 days to 6 weeks, depending on the severity of the soft tissue injury. The final stage, the remodeling stage, is when we start to see our body tissues having been healed. Now, the issue with this stage is that a lot of athletes go back to playing sport or training before this stage is actually complete, and so therefore we end up actually building more scar tissue, which again, as we know, is actually weaker than normal tissue. So at this stage, at the remodeling stage, we continue to rebuild the injured area, and we sometimes see an increase in scar tissue, but also in functional tissue. Now, functional tissue is obviously that tissue that we have in our bodies normally, and that's obviously the tissue we want to see. So this is where it's essential to be involved in rehabilitation programs at this stage, because it allows for tissues to replace those scar tissues that were built in that repair stage. Now, this remodeling stage can last for several months depending on the severity of the injury. So now we come across the syllabus and we have a look at how do we actually manage soft tissue injuries, and we look at the concept of RICER. So for most of you this won't be new, but we still need to go over it just in case. So we've got RICER, so the R stands for rest, the I for ice, the C compression, E elevation, and R referral. Now it's really important that you must use this method within the first 48 to 72 hours of that injury occurring. Now, it may be for longer than 72 hours if you've actually got a referral to a doctor or a physiotherapist and they've asked you to do further treatment, but we'll talk about that later in the video. So when we have a look at the rest component of RICER, it basically just means avoid using the injured part of the body. If you have to use it to sort of, get from one place to another, that's okay, but trying to restrict exerting yourself. And rest can either be lying or sitting or anything that's comfortable that doesn't cause further pain. You want to try and limit further pain and movement because you are trying to restrict blood flow to the area. So if you're resting and you've got your foot up or you're lying down, that's obviously going to stop the body from applying that inflammatory response even further if you're exerting yourself still. So the next stage of management is ice. Now you apply ice or cold packs to the injury for 20 to 30 minutes every 2 hours. Now there's a bit of debate around as well, how long do you actually apply that for? Obviously we know that ice helps reduce further swelling and thus aids in the recovery of the injury. So obviously just apply ice for as long as you see fit. But obviously if you've had referral to a doctor or a physiotherapist or a team medic, they will obviously tell you how long you need to be applying the ice for the type of injury that you have sustained. The next stage of the management is compression. Now you can compress the body in different ways, but obviously when you've got an injury, you want to wrap the injured area with a wide elastic bandage. Sometimes they have a compression sock which you can put on, a nurse might give you that, or you use a compression bandage. It's important to make sure that it's wide to allow for the swelling to occur. By applying compression, this obviously again helps reduce blood flow and swelling, and at times can also provide some support to the body if there's like some serious damage, say some tearing to muscles. Now, one thing that's really important with compression is in the early stages of the inflammatory response to avoid taping. And the reason for this is that strapping tape doesn't have the flexibility or the elasticity of what a compression bandage has. So if let's say you've rolled your ankle and you've got strapping tape on it, what actually will happen is that the swelling will sort of try and swell out through these gaps in the tape, which can cause further damage and other soft tissue injuries such as blisters and cutting. Obviously, if you've got tape on and you've injured yourself, that would be at the discretion to the team medic or the person applying first aid as whether they'll leave that on or take it off, because it may in the initial stages aid in the response. So once we've had a look at, getting rested, lying down, applying some ice to the area and compressing the area, the next step would be to raise the injured area and if possible above the level of the heart. And you need to make sure the athlete is comfortable. So if the athlete's standing up and they've injured their foot, obviously trying to elevate their foot standing up is not going to be the most comfortable thing. So the easiest way is to sort of put them on a chair or on a lounge or sort of leaning up against a wall and trying to lift their leg. And as I said before, if you can get their leg above the heart, that's best. And the reason for the elevation is it helps reduce blood flow to the area and obviously therefore reduces further swelling. And then finally, we look at this concept of referral. Now, if the injury is serious, advice from a doctor or physiotherapist may be required. Now, sometimes some athletes will just automatically go to a physiotherapist or a doctor as soon as they're injured because they understand that seeking referral can actually aid in the recovery of their injury. Some people may not wait, they may wait till longer when they realise that it's taking too long to recover, so they'll go and seek assistance. And obviously we need to seek referral to make sure that any possible serious injury is diagnosed and therefore treated in the right way, because sometimes an athlete may think that they're okay and ready to return to play, but then actually end up doing further damage because it hasn't been diagnosed. And obviously a physiotherapist or a doctor can ensure that a suitable rehabilitation program is planned and implemented at the right time for the athlete to ensure that they get back to play as soon as possible. Now, it's important when we look at the management of soft tissues to have a look at some things that may be harmful or that counteract RICER. Now, one way we remember this is by the acronym of HARM. And obviously harm being harmful to us when we're trying to recover from injury. And these are the things that we need to avoid to help our body try and recover faster. And if we don't avoid these things, we're obviously going to have a decreased recovery rate, and it's going to take longer to heal from that injury. So obviously we need to avoid things like heat, so saunas, spas, those sorts of things. Try and stay away from those if you have sustained soft tissue injury. Alcohol, running or exercise, because obviously this is going to further aggravate the injury, and massage to the area. So we need to compress that area to try and decrease the blood flow. We don't want to apply massage, which will obviously sort of look at moving blood around the body and getting the body sort of feeling relaxed. Massage can sometimes do further damage to body, especially if there's some serious bruising there. So leave the massage up to the physiotherapist, and they will obviously apply massage where needed at the appropriate time in your treatment stage. So again, when you have experienced a soft tissue injury, you need to try and apply the HARM principle by avoiding heat, alcohol, running or exercise, and massage. So we've had a pretty in-depth look at RICER, and it's really important that you need to apply this in the very early stages of the management. And sometimes if you do this straight away, can actually, if it's a minor grade injury, say grade 1 tear or sprain, this can actually sort of allow the player to return to play quite quickly if you apply RICER very fast. Now, obviously, if someone who's got a more serious injury in the later stages of recovery from that injury, if they've sought referral, the physiotherapist or the doctor may suggest strategies such as massage and stretching and strengthening exercises to try and get that player ready to go back to their game or to whatever sport they're playing. And we're going to have a look at these concepts and how do we actually know when the player is ready to go back later on in the syllabus.